as well. Just a little bit about what we are here, what the panel is about. We're going to be discussing 3 different types of evidence-based treatments, specifically emerging clinical practices. And there's a little bit of a weave between all 3 of these programs that we're working on together. 3 different locations, 3 different types of settings, but we're trying to advance the field when it comes to implementing new and innovative practices in our settings. So you'll hear a little bit about the incorporation of mindfulness into residential setting. We'll talk about sensory rooms, and you'll also hear about HeartMath, this really great project that is being done by fellow panelists that we have up here on the stage. So jumping quickly into my piece right here. Let's see if I can use this too. There you go. That's a little easier. So I kind of struggled with what I wanted to share with you guys and realized that mindfulness is something that is becoming a lot more prevalent throughout clinical treatment, but oftentimes people are hesitant to either use mindfulness or incorporate any forms of mindfulness because there could be some associations attached to the terminology of mindfulness. So we'll talk a little bit about that. Mindfulness has its roots in Eastern meditative practices, with the idea of just increasing consciousness and becoming more aware of your bodily sensations. This practice was developed to help accept distressing thoughts and then work towards, some of the changes of those thoughts. It also helps people often who are having destructive self-urges and helping them kind of by calming down, slowing down before they go into that practice. Deep breathing, progressive muscle relaxation, mindfulness meditation, mindfulness eating, are all different forms of mindfulness, and we're less going to discuss the different forms that mindfulness can take and more about how to possibly begin the conversation with any particular client as to are they interested in doing mindfulness. There is a ton of research behind it, and we won't go into depth about the research. I picked specifically research that's happening in Los Angeles, near me, at the UCLA Mindfulness Center, where they used an adult study to show that mindfulness was decreasing relapse of mood symptoms and helping schools with increased self-control, improved academic performance, and slightly in my presentation earlier today, I talked about how we try to incorporate mindfulness into our program. We have medication hours at 9 a.m. and 9 p.m., but each of those hours also has a mindfulness practice as well, so clients can attend and get medication, or they can attend and be part of some kind of mindfulness-based practice as well. So where I work, mindfulness is a dirty word. These are quotes from people, not the Samuel L. Jackson on the side over there, but I'm not going to do that hippie LA crap. I've heard that a lot, and it was something that I probably would have said in my earlier years too myself. I got real problems to deal with. That's a skill for the kids. That's something that the kids can try rather than me. So we've tried to incorporate innovative ways to bring up the discussion of using mindfulness without using the term mindfulness. And I just thought these were funny, so I put them up here because that's totally me when I'm trying to become a little more focused and mindful. But we thought about taking into consideration this better way. And this will be up for anyone who would like to, and you can kind of just look at these slides later on or use these terms. But the idea is take into consideration all of your mental thought processes, anything that you're thinking past, present, or future. Take all of those different tenses and put them onto 3 points of a triangle. So you draw a triangle on a piece of paper in front of your clients, and you write the word past, present, future on that triangle, and you ask them, if you could split up your time between 100%, how much of your time is spent thinking about the past, how much time is focused on the future, and how much time is focused on the present? I'll take a quick moment to pause and see if anyone wants to shout out an answer as to what they might call their split when it comes to this 100%. Anyone want to gauge what they might be feeling? I promise you I will not diagnose you at the end of it. Any takers? You don't have to. Lunch just happened. Yes, got somebody in the back.
Is it what we're doing now or what we want?
What you're doing now.
I would say like 60% past, 20% present, 20%
80% past, 20% present, 20% future. Doing the math quickly, that does add up to 100, thank you. Just making sure that we have that, yeah, and that's a fairly common answer. I myself, when I thought about this, was spending roughly 40% in the past, and about 30% in the future, and 30% in the present. And we sit down, draw a triangle with clients, and ask them, give us your perspective on this. And then what we do next is we share with them some of the data and the research as to what the direction we want to be going in looks like. And that is 15% in the past, 70% in the present, and 15% in the future. Now those numbers might seem somewhat jarring in terms of how much. The idea is to be more in the present than in the future. And there's a plus minus that is incorporated into this. So younger people should be leaning more towards the future. Older people should be leaning a little more towards the past. And again, these numbers, this is our perspective. There isn't any research or data on it yet that's published that says 70% is the number to go with. But it's just an understanding that moving more towards being present focused is something to take into consideration. And what we sit with the clients and say is excessive focus on the past can increase depression and anger. Excessive focus on the future can increase anxiety and purposelessness. So we use this as a tool to gain their commitment to treatment. And we don't say, let's try mindfulness now. What we then say is, would you be interested in becoming more present focused to help you create a life worth living? You can use that direct quote. There's no copyright infringement on that quote. Would you be interested in becoming more present focused to help you create a life worth living? And then at this point, you can move into adding some of those practices that we talked about and some of the benefits that mindfulness may bring, such as mindful-based eating, mindful meditations, or incorporating some kind of pause in your day. 4-part breathing is a great one. It's one of my favorites. I learned from one of the kids that I was working with at one time that if anyone knows the comic Kirby, where Kirby like breathes in and sucks in an object and becomes that object and spits it out, that he pictured Kirby when he would do his breathing, and he would breathe in really, really strong like Kirby and puff up and then breathe out his issues. The term doesn't have to be mindfulness, it doesn't have to be meditation, it doesn't have to be called Zen. You can move it away from the religious Eastern practices, you can move it away from those specific kind of West Coast hippie perspectives, and go into whatever you want to call it, being more present focused, creating a life worth living. And if you can help your clients decrease their emotional reactivity, have more cognitive flexibility, increase their happiness and decrease their rumination and stress levels, you are definitely going to be on your way towards supporting them in your practice. So this is just like I mentioned, a quick, touch on this mindfulness idea. Go ahead and try it sometime. Put down on a sheet of paper your own personal triangle. Where do you feel you are? Are you sensing that you might be somebody who's very anxious and has a lot of, thoughts that ruminate in their mind? Maybe you're focusing a little too much on the past. Are you on the future? Are you somebody who is ruminating about the past a little too much? Is it possible that you're not as happy or successful in terms of your own clinical thought process as you'd like to be? And start to see ways that you can shape yourself up that triangle. The last piece that I would just recommend or suggest is there's an app that's called Calm. It's pretty cool, calm.com, or an app called Calm, that has a lot of mindfulness-based practices on there. It has the sound of I sleep typically is the sound of rainfall from the app, and it's really soothing and it's really effective. It's free. It's something that all the clients can download on their phone, or you can have on your phone, and you can pull up anytime, whether it's a mindfulness for stress, whether it's mindfulness for anxiety, for depression, for sleep, and you can incorporate it into your daily practices with your clients. So thank you so much for listening, and I'll pass it along to our next speaker. And again, like we mentioned, just please hold your questions towards the end. Thank you.
All right, good afternoon, everybody. As introduced, my name is Mallory,
and I'm the clinical supervisor at Pivot Crisis, which is that crisis residential program in Grand Rapids, Michigan, operated by Hope Network. And just to start you off by giving you a few facts about Pivot, just to kind of orient you to the context from which I'm speaking. Pivot Crisis is, we would call it a crisis residential unit, so you may hear me refer to Pivot as CRU, or crisis residential, throughout my presentation. And we happen to be a 16-bed location, and our average length of stay is only around 5 to 7 days, so quite different than what Alon has shared about his 28-day program. So we just have a very brief opportunity to be providing a very needed and intense intervention for folks. Our program also happens to be unlocked, so completely voluntary. And we're staffed by a variety of staff, including psychiatrists, nurses, social workers, peer support specialists. We're serving adults, and our treatment at Pivot is focused on stabilization through medication, through therapy groups, through individual meetings with social workers and other clinical staff, and also a high focus on discharge planning, as a lot of other programs have discussed today. So there's a little bit of the context from which I'm speaking. I'm going to be sharing about how we were able to implement a sensory room in our program and the impact that it has. And my hope is that this presentation will be very practical and be able to be something that you kind of take with you and think about, does this make sense for my setting? And if it does, I feel like I know how to take this back and implement it in my crisis setting. So with that, I'll start off with, of course, what is a sensory room? Sensory rooms are what we could say specially designed environments created in order to give an immersive sensory experience. So they incorporate visual, tactile, auditory, olfactory, those kind of tools to foster many things. Crisis de-escalation, emotional awareness, emotion regulation, self-care, and skill development. So sensory room is kind of an umbrella term. It's kind of a wide term to incorporate a lot of different sensory type environments. So you may hear sensory rooms also called sensory modulation rooms, or sensory integration rooms, or even snoozle-in rooms. I'm not even sure if I'm pronouncing that correctly, but I found some information on the internet about that. So sensory modulation room is probably what feels most applicable to most of the programs in which you work. This is essentially a converted quiet room space whose main purpose is to either de-escalate crisis or to prevent it from happening in the first place. But perhaps more specialized rooms feel appropriate to your setting too. A sensory integration room is usually kind of operated by an occupational therapist who's very specially trained in sensory integration intervention using very specialized equipment. And then that snoozle-in room that I described is more so for folks with moderate or profound cognitive impairment, which helps promote relaxation, social interaction, and a more intense sensory experience. So, like I said, a sensory room, as I'm going to continue to refer to it as, is really an umbrella term. And they're everywhere. So you're going to find sensory rooms in hospitals, in emergency rooms, in day treatment centers, in skilled nursing facilities, in hospice settings, and of course, in crisis residential facilities. And actually, would you guys mind raising your hands? Does anybody in here have a sensory room within their program? Okay, a couple of you. Great. So they're in some crisis residential programs, and hopefully that will be kind of an area of growth. And the reason that we're able to see sensory rooms in so many places is because they are so flexible and can really be tailored to the needs of your program. If you're having a hard time understanding what I really mean by sensory room, I wanted to provide you with a few kind of visual pictures of what a sensory room looks like. So as you can kind of see from the photos in front of you, they're usually they're uniquely created. So like I said, to meet the needs of your program, you're going to uniquely choose items to fit your setting. You'll notice that they're very colorful. They seem very inviting, they seem very comfortable. They're very organized and just kind of really capture your interest. So I wanted to share with you, kind of from start to finish, how do I operationalize a sensory room? If you're not a program that already has a sensory room, where do you even start and where do you go from there? So first up, I obviously have to secure the funding. So this can happen in a number of ways. There's grant opportunities out there, I'm sure, and that might be a great way to get funding for kind of creating your dream sensory room. If your agency has a foundation of sorts, that can be a great kind of question to ask of your foundation, especially given how beneficial, I'm going to share a little bit later, these rooms can be to a program. Or finding donations. The beauty of a sensory room is that while it's nice to kind of get a large sum of money up front and be able to build your dream room right off the bat, that's not necessary. You can always kind of start small and have the room evolve along the way. So after you've secured some funding, I apologize, I'm just going to step over and grab some water. After you've secured the funding, you get the fun part of picking what kind of materials to put in your room. My number one recommendation here would be to ask the people that you're serving and ask your team members for input. They're going to be the best source of inspiration, I suppose, for the tools that they're interested in, the theme of the room that sounds interesting to them, or how they want the room to be decorated, and even naming the room can be a really fun task for the people that you serve in your programs or your team members to chime in on. I feel like I've heard that as a recommendation throughout this conference, that the best people to recommend or to inform the service delivery that we're doing is the people that we're serving. So every opportunity that you can, I recommend asking the people that you're serving. Another advice as far as materials goes would be to get a variety of things. So I mentioned, just a few of the sensory arenas. Get a few tactile things, a few olfactory things, a few auditory things. Just kind of create a wide experience and a wide variety of things so that you can hopefully be meeting all the unique needs that the people that you're serving have. And everybody can find something that interests them in there. Comes as no surprise probably that I would recommend that you choose items that are durable and easy to clean. So something that probably doesn't soak in odors or something like that, something that's easily wiped down. That's something definitely to consider as you're choosing your items. And then kind of jumping off my comments about funding, you have to think about, of course, how much money do you have to be spending as you're picking your materials. So you kind of have to ask the question, does it make sense to dream big and get some really expensive, innovative, captivating type tools in your room? Or even if you have a small budget, does it make more sense to choose items that can be easily replicated as the person goes to what they call home? Something that they could kind of get a taste of as they're in your crisis setting and go home and recreate it for themselves. There's kind of an endless source of websites out there that can give you ideas and options to choose from for items. So our program in particular used a website called specialneedstoys.com, but really you can probably go to an endless number of websites and find some really great options out there. I wanted to speak a little bit about staff training. That feels like the next kind of thing you have to take into consideration. I would recommend kind of jotting everything down into a procedural format. I'm a big proponent of procedures. Just kind of serving as a strong reference point and to inform, especially as you have new team members come on board, how to be using the sensory room. So my recommendation would be for your procedure to include, specifically for your setting, what is the purpose of the sensory room in your setting. I think a procedure should also outline how will you implement training your team on the sensory room at the start, and then also how will you train or ensure that new team members are caught up to speed when they come on board. So we're probably all no stranger to staff turnover either, so that's a really important piece to remember, so that the room is being used as it should and to the benefit that it can have. Speaking about Pivot in particular, we invited an occupational therapist from elsewhere in our agency to speak about sensory rooms, to educate the team on what they're all about. And then in an ongoing fashion, we incorporated orienting new team members to the sensory room via like a new hire orientation type checklist. And we also plan to have kind of periodic in-services provided for our entire team, probably on a yearly basis or so. I would think that the procedure should also kind of outline a protocol for how do we introduce consumers to the room, and how should the room be used by consumers, what kind of rules should the room have. And so I'm going to be speaking a little bit more about rules a little bit later in my presentation, so hold on to any thoughts or questions you might have about that. So kind of the fourth thing to take into consideration when thinking about how to operationalize a sensory room is how do we bring consumer awareness to the room. My recommendation here would be to promote it at every opportunity that you get. So right from the time of intake at Pivot, we incorporate looking and seeing the sensory room right as they go along for their program tour when they first get to Pivot. So recommend kind of introducing it to them right from the get-go. I mean, sensory rooms are great for relaxation and reducing anxiety, and that first night in a crisis program can be very nerve-wracking and scary, so it would be a great option for people to see that they have in that first night when things all feel very new. As far as consumer awareness goes, you also want to encourage your clinical teams to be bringing it up and reminding people that the sensory room is available to them as they're facilitating perhaps groups in your program or offering those one-on-one sit-downs with folks, to be reminding them that this is a great venue for self-care and a great way to be practicing your coping skills that we're talking about at other times in the treatment. Encourage your team to be very observant and to suggest the sensory room to consumers when they notice that they appear anxious or they notice that they're looking pretty down, or quite frankly, even if they look like they're bored. The sensory room is a good place to spend time no matter how you're feeling, quite frankly. So to be kind of reminding your consumers to be checking it out at any time that there's downtime during the day. I'd also recommend kind of posting promotional flyers or reminders throughout your program, kind of visually reminding people that that room is available to them. With that, I'll show you a few handouts that we've developed in our program. That middle one there is what I would consider to be kind of a promotional flyer. Kind of has that eye-catching question, have you been in the room yet? Provides a description of what the room is all about, and then visually shows some of the cool objects that we have in the room to kind of get people interested. The other documents that I have up here to show you are a couple of our other forms that we developed. Over on the right-hand side, we have what we call our wait list. So we have this posted on the outside of the sensory room door. It just asks that people write their name down whenever they're going to use the room and the date and time in which they used it. And this also is really helpful if there's more than one person that would like to use the room at a time. Like I mentioned, I'm going to go through the rules in a little bit, but one of our rules is that only one consumer can use the room at a time. And if there's somebody waiting, only for 30 minutes. So this kind of helps us keep track of who's next in line and make sure that we're kind of operating in a fair manner for people. Also, this kind of serves as a manual tracking tool to see how frequently is the room being used and who's using the room. And perhaps even if an item in the room goes missing, you might be able to kind of circle back with the people that use the room and hopefully determine where the item might be. And then over here on the left, I have the rules that we've developed as a program. So speaking of rules, there's several considerations that you'll want to speak with your team about when creating the protocol from which you'll operate your sensory room from. Again, I'll say here that these should be decisions determined by your team and maybe even the people that you serve as well. It's really important to get their input in these kinds of decisions. So some considerations that I would suggest, some considerations that we made before we implemented our sensory room at Pivot is how many consumers should be allowed to use the room at one time? Like I said, our program, we decided that one person can use the room at a time, but that might not feel necessary in your program, so think about whether or not you'd like to afford more than one person in there at a time. Do staff have to be present while the room is in use? We've elected not to make this a requirement, but perhaps you and your program feel differently. You feel like a clinical team member, a direct support professional should be present in the room while the person's in their sensory room, so that's something to consider. Should there be a time limit on how long a consumer can spend in their room at one time? Like I said, we've kind of put a 30-minute time limit on it, but that is only in the event that there is somebody else waiting to use the room. So if there is nobody waiting, we don't have any type of time restriction on people when they're using the room. And that's simply because we believe that the room is really helpful, and if the consumer sees it as a really helpful room that's helping them to manage their emotions or cope or self-care, then by all means, stay in there all day. You have to consider how do you ensure that tools are clean and in working order. So we have kind of a designated team member that's kind of monitoring the room at least once a week and wiping things down and making sure that things are organized and in their rightful place. You have to consider whether tools should be allowed outside of the room. So you could elect to kind of have a sensory cart that can be pushed outside of the room and brought into people's rooms or brought into a therapy session. Or maybe it feels like for safety reasons or for protecting the equipment type of reasons that you feel like all of the items should be kept in the room. You have to consider, should any consumers be excluded from using the room? For instance, those who have recently self-harmed or been aggressive. And should consumers be asked to complete a self-report tool? So an anxiety rating scale, for instance, we've been talking a lot about data and data collection. So if it feels like measuring levels of anxiety or any other measure before and after a person uses the room, then you might want to consider using a self-report tool as they enter the room and as they exit the room. I wanted to provide you with a list of some suggestions or ideas of what you could put in a sensory room if you're looking to create one in your program. By all means, this is not an exhaustive list. So I mostly included things that we've elected to put in our sensory room. But you'll see that there's a variety of tools, and they're from a variety of senses. So looking over at the auditory tools, a radio or CD player feels like a very basic necessity to have in a room. This affords you the opportunity to play music or to play a guided meditation CD or a progressive muscle relaxation CD. Sound machines, of course, are very soothing and useful to people when they're escalated or feeling uncomfortable. Visually, there's something called an Aquarium bubble tube, which is a personal favorite of mine. It's kind of this tall column filled with water, and it has neon lights, and you get to adjust the color of the lights, you get to adjust the speed of the bubbles. There's also kind of a couple fake floating fish in there. And so I imagine you see it like a dentist office or something too, but it's just a very kind of soothing, cool tool to look at while you're in the room. Scenic posters, a disco light perhaps, or a fiber optic light, self-help books for people to read, journaling and art supplies are always a big hit. In the tactile sense, there's something called a vibroacoustic therapy chair, which is it's definitely a big ticket item. So unless you're somebody who got some grant funds or some foundation funds. This is probably outside of your capability, but this is awesome chair. It's kind of a kidney bean shaped chair, and it's actually connected to a Bluetooth device, and you get to choose the music that you play, and the music will play through the chair, and the person gets to lay on the chair and feel the pulse or the beat of the expression of the music through the chair, as well as listen to the music. You can have a textured wall, a bead curtain, which is kind of beads hanging down that you can kind of run your fingers through and feel the cool sensation. Stress balls, of course, weighted lap pads, a handheld massager, and a personal favorite of mine, a vibrating hairbrush. that's a big hit too. And then olfactory-wise, an aromatherapy diffuser, you can't go wrong with one of those. So I've shared a bit about what sensory rooms are all about, and I wanted to share what kind of impact have they been having in my particular setting, and what kind of impact could they possibly have in yours. So I wanted to start with some anecdotal type of data. Asked a few consumers what they thought of the room after they used it, and so I wanted to share some of their testimonials, so to speak. So one consumer shared, "I was in rough shape when I was at Pivot, anxious all the time. So it was nice to have a room to retreat to and be alone. The room helped alleviate my anxiety. It was calming and relaxing. I liked the music. The massage chair was really nice, and I liked the vibration." Another person said, "I went in the sensory room every day when I was at Pivot. I liked that it was quiet and I could be alone in there. It was very relaxing and helped me collect my thoughts and lower my distress levels." And a third person said, "My experience in the sensory room was good. I went in after CPS visited me, and it was perfect in that moment. It gave me the quietness and distraction I needed to escape my fear and anxiety for a while. It helped me focus and practice the coping skills. I felt so much better afterward. I can see how it would be incredibly helpful for someone experiencing a panic attack." So like I said, of course this is just anecdotal data, but I think to some extent just asking the people that you serve what they think of the room is a really good indicator of whether or not it's worth an investment for you. Also, kind of anecdotally, I've described that we have that wait list, and we can kind of look to see how frequently the room is being used. And one thing I've noticed is that if a person uses the room, they are likely to use it again. So it kind of shows some ongoing interest in the room helping them. And I think these quotes really capture some of the goals of the room, which are to help regulate emotion, to provide an opportunity for self-care, and also to be a venue for practicing coping skills. If you're less interested in anecdotal data and like more of the hard numbers like we've been discussing today, more measurement-based care, I wanted to share with you some of those numbers. So when we implemented the sensory room at Pivot, our main goals as far as numbers go were to see an impact from the sensory room on our elopement numbers, our self-harm incidents, our incidences of psychiatric hospitalization, and our incidences of aggression. So we have an electronic medical record. We were able to pull data right from that, from our incident reports. And so I was really pleased to look back at the numbers and see that sensory room is likely having an impact in all these areas. All of these numbers reduced. These numbers are from 5 months pre-implementation of the sensory room and 5 months post-implementation. And I just chose 5 months because it's only been 5 months actually since we implemented the room. It was opened in April. So these are the preceding 5 months and the 5 months since then up until about now. So for elopement, we've seen our numbers go from 4% to 3%, which shows us a 25% reduction in elopement. Our self-harm numbers went from 4% to 0.9%, which is a 55% reduction. Our psychiatric hospitalization rates from Pivot reduced by 33%, and our aggression rates reduced by 81%. It went from 1.6% to 0.3% of incidents. So very proud to share that. I'm really excited to see the impact that the sensory room has had at Pivot, and I hope that my presentation has been convincing to show you that the benefit of a room like this can be great for your program, and to operationalize it is not all that complicated and feasible for you, and I hope I was able to provide you with some pretty concrete steps to walk away with from here. So with that, I'll pass it off to Kendall.
Hello, good afternoon. So as a reminder, my name is Kendall Basor. I'm the clinical supervisor at Robert Brown Crisis in Western Michigan. So similar to Mallory, we're within the same organization. However, I run a 6-bed crisis unit, so we have kind of a much smaller field. So we can really have a lot of hands-on experiences when we're implementing a lot of new programming. So it's really nice. So I want to take a quick poll before I get into this. Has anybody heard of Heart Math, or has anybody done Heart Math within their facilities? Good, a few of you. So a lot of you don't. So I'm excited to hopefully teach you a new aspect that you might be able to bring to your consumers. So I wanted to start off with a little analogy to kind of make sense for everybody. So most of us probably own a vehicle, or if we don't, at least have driven in one or maybe used one to get here today. And our cars are meant to be run efficiently and effectively with all the parts working together in order to get us where we need to go. But if one of those parts aren't working, it can affect all the other components, eventually affecting probably some major components of the car until the car shuts down completely and is no longer able to successfully run. And this is what happens when our bodies aren't managing our own stress levels. We know that stress has a major impact on all levels in our life and causes our functioning to deteriorate. Okay. So biofeedback is a non-drug treatment in which patients learn to control bodily processes that are normally involuntary, such as muscle tension, blood pressure, or heart rate, for the purpose of improving issues related to physical, emotional, spiritual, and mental health. So at its roots, biofeedback therapy helps reduce a wide range of symptoms by lowering sympathetic arousal. Through identifying and changing certain mental activities and physical reactions, biofeedback trains our patients or our consumers to help regulate their own unconscious bodily processes, and then they're able to better control their stress response. So after reviewing 63 studies related to biofeedback, the Institute of Psychiatry at King's College in London found that nearly 81% of studies reported some level of clinical decrease in symptoms as a result of biofeedback exposure, and 65% of those studies to a statistically significant level. So that's pretty huge. And surveys show that in the US alone, approximately 38% of adults, so more than 1/3 of adults, and 12% of children are already using some form of alternative therapy similar to biofeedback that draws on biofeedback training. For example, meditation training, yoga, self-imagery, and deep breathing activities all include elements of learning through feedback and reinforcement. So science has shown that humans are made up of electromagnetic fields that you can see in the graphic. And the magnetic component of the heart's field is actually 5,000 times stronger than that of the brain. So different emotions affect the heart rate variance, which is the time between the beats of your heart, which affects all of our body at the cellular level, as well as energetically affects other people around us. So when the heart is beating in a coherent, even pattern, it radiates a more coherent, even electrical magnetical signal, then which affects other people in a positive manner. So traditional psychology states that if you think differently, you'll feel differently. So basic CBT that most of us have probably been trained on or learned about. But current neuroscience actually tells us that this is only partially true. So what what we know from science is that stress and emotions of all kinds are reflected in our heart rhythm pattern. And heart rhythm pattern is a combination between our heart rate and then the heart variance, which is the beat to beat. And that's because what we are feeling changes the activity in our nervous system, which then affects our heart rhythm. Research shows that it is the heart and not the brain that is the regulator of emotions. And although women probably are going to this right. I guess I should step back and say the heart actually sends 60 times more electrical signals to the brain than the brain sends down to the heart, which influences the way the brain processes the information given to it. So feelings of frustration and anxiety cause the heart's rhythm to become more disordered or irregular, which inhibits the higher brain center's ability to function. But on the other hand, feelings of love and appreciation generate a more smoother pattern, which promotes higher brain center functioning. So it's true also that when we think differently, or when we feel differently, we think differently. So, and this is where heart math comes in. So heart math is a set of techniques that are based on over 25 years of research. And what the Heart Math Institute has figured out is that one of the most effective ways to reduce stress and anxiety and even feelings of being overwhelmed is to learn how to access the intelligence of the heart and shift the rhythms of the heart that sends those neurological messages to the brain in order to improve brain function. So basically, if we can change the way that our heart beats, we can influence the signals that it sends and make a positive impact for our clients. So that's awesome. So heart math researchers conducted numerous studies utilizing different physiopsychological measures. So brain waves with EEGs, conductance, blood pressure, and then hormone levels. And it was actually the heart rate variability that stood out as the most dynamic and reflective indicator of one's emotional states, and therefore their current stress and their cognitive practices. So I want to explain just what heart rate variability is, because before learning heart math, I had no idea what that meant. I just thought it beats at a certain rate in a minute, and that's all I needed to know. But heart rate variability actually has nothing to do with your heart rate. It's strictly the time between the beats. So it can be boom, 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 or boom, 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 boom. And they're not looking at how many times your heart beats per minute. It's looking at the just type of time in between the beats. And that is what's reflective of the emotional states. So a lot of people think my heart's beating out of my chest, I can feel it. And obviously, oh, I'm anxious. It really has nothing to do with that. It's the amount of time in between the beats, not the amount of beats. So I thought that was interesting. I had no idea. When our heart rate variability is uneven, or what heart math calls an incoherent pattern, it can indicate emotional distress. But the heart is a muscle, and like all muscles, it can be trained to work better and more efficiently. So heart math does this by combining traditional training of breathing techniques with eliciting positive emotions that research has shown to lead to coherence. And not all positive emotions have been shown to actually do this, but things such as appreciation, love, and gratitude, and feelings of confidence, which I do not have right now because I'm shaking. You guys can probably tell. So I'm not coherent right now. Combining those techniques, the breathing techniques, with eliciting a positive emotion within a client can lead them to coherence and then improvement in functioning. And it's this emotional shift specifically, not the breathing, that's the key element of the technique's effectiveness. The breathing just kind of helps you get there along the way. It gives them something to focus on. So the positive emotions actually appear to excite the system at its natural frequent residency and enable coherence to emerge and be maintained naturally, even when the consumer forgets to monitor their own breathing. Just having that emotion in their head and feeling that throughout their body, they can completely forget about their breathing and they're still coherent. So what do we actually mean by coherence? There we go. So coherence is an optimal state in which the heart, the mind, and the emotions are aligned and in sync. So physiologically, the immune, the hormonal system, and the nervous system are all functioning together and are synchronized. Or another definition is just the state of synchronization between the heart, brain, and nervous system. So you'll see on the left on this screen just what being in coherence can influence. So it reduces stress and anxiety, it improves emotional self-regulation, it increases attention and memory, it improves our ability to process information and learn new information. I should say memory, both long and short-term memory. And being in coherence and learning how to get there can help with just multiple things. We've seen improvements with insomnia, or just amount of times waking up at night, chronic pain, because you learn to control your bodily functions, and that pain is all, a physical symptom. Addiction, anger, heart arrhythmias, obviously, and hypertension, and there's multiple other, and that doesn't even include, obviously, our mental health symptoms that our clients have. So, why teach this to our clients? I mean, it seems kind of obvious, right? But, it helps us build rapport with our clients. They want tools that gives them that sense of, I can do something about what's going on inside my body, and I can do something about my stress and my depression. It helps them obviously manage their symptoms. And it's a tool they can work outside of therapy, outside of once they leave. These are things that they can take with them and continue on an outpatient basis, which is great. And obviously helping them helps us too. If we're teaching them and mirroring, it's making sure that we're coherent. And obviously this job is stressful, what we do, and we're probably not in coherence most of the time, so just practicing it can help lead to more positive outcomes in us as well, and reduce that burnout rate. So I want to kind of demonstrate, they have multiple ways of getting there, so I want to demonstrate what they call the quick coherence technique. And the language is pretty specific, so I'll probably kind of read off my sheet, but I want you to focus your attention on the area around your heart, that area in the center of your chest. And if you like, you can either close your eyes or you can place your hands on the center of your heart and your chest to help kind of keep your attention in that area. And I would actually suggest you do it, it kind of helps. So I want you to breathe deeply, but normally, and feel as if your breath is coming in and going out through your heart area. As you inhale, feel as if your breath is flowing in through your heart. And then as you exhale, feel it leaving through this area. So breathe slowly and casually, but a little deeper than you normally probably would. And I want you to just continue breathing with ease until you find a natural inner rhythm that feels good for you. So as you maintain your heart focus and your heart breathing, I want you to activate a positive feeling. You can recall a specific memory where you felt a feeling of love or appreciation for somebody. It could be the birth of your first child, getting your college degree, getting a well-earned promotion at work, or even the moment of getting married and seeing your spouse walk up or down the aisle and seeing them for the first time. And once you have that emotion and have that memory, I want you to just feel it within your body and continue breathing in and out through your heart. Okay, for everybody that closed their eyes, you can open your eyes. So how was that? Was everybody, you feel more calm? I probably put some people to sleep. Wake up. Don't fall asleep on me yet. Wake up. How was it just trying to elicit that positive emotion? That can be hard for people to kind of go back there, especially people that have very horrible memories like I do. But it can take a while, and that's probably the hardest part, I think, especially for our depressed or our very anxious consumers, is just remembering a positive memory. When I do this technique with people, I typically give examples, like I just did to all of you, and I'll walk them step by step. I'll have them give me the memory first. What do you remember? What did you see? Even sometimes sensory. What did you smell? What did you hear? to make sure they're going back in that memory. And I'll ask questions about that memory to really try and draw it out for them. And once they're able to do that, then I kind of let them have it on their own, and I'll start the coherence technique. But it can take a while for people that are really in a really negative place. So I might not start this with them right away until they're a little bit more kind of cleared, but it is doable. So I want to kind of demonstrate how this all works, because hey, that's the point, right? So I know for people in the back, it's hard to see, but this little gadget up here that has some blue and green lights on it, this is called an M-Wave. HeartMath has a couple different programs that you can use along with the M-Wave. And I can pass it around later if people want to see it or are interested in it. But it was developed by Doc Childre, and it's a unique training system which objectively monitors your heart rhythms and confirms when you're in coherence or out of coherence or even close to coherence. So it goes from a green light to yellow and red. So familiar light system that people are normal for people. I love to use this with consumers that just tell me coping skills just do not work for me. Or, I hear, I just didn't feel any different. I'm doing the breathing and I just don't feel any different. I still feel like crap, this isn't working. You need to give me something else. This way they can kind of objectively see on this screen what's going on in their body. And I can say, well, you might not feel it, but your body certainly is. So it's kind of a way to check with them, especially when you kind of have the Debbie Downer people, which everybody has in every program. So the M-Wave is actually different from a lot of devices. I know even at Walmart and Meijer now you can buy these biofeedback devices for pretty cheap actually. What's different about the M-Wave is that most biofeedback devices only measure your heart rate. It does not measure your heart rate variance, so that beat to beat, which is the key of coherence. So you completely miss all of that in most biofeedback systems. And it also obviously tells you when you are coherent. So they're measuring both objectives. It tells you when you're in coherence or when you're close to coherence, just by analyzing those heart rhythm pattern second by second, which other monitors just don't do. So kind of in general, before I kind of show you how it works, I'll just say that a smoother resting heart rate pattern indicates more synchronized autonomic nervous system. So it's a more balanced emotional and mental state. And then a more irregular and jagged resting pattern indicates less synchronized nervous system. And so you're probably a little bit more stressed, a little bit more anxious and depressed. But by using their algorithm, the M-Wave kind of analyzes the degree of smoothness and jaggedness, not only the amount of beats per minute, but just the time in between all the jaggedness. I can't do the math. I am not a math person, and that's why HeartMath is so great that it just does it for you. And as you improve your score, you become more coherent. The awesome thing about this system too is it finds what's natural for you, because what might make me coherent might not make other people coherent. So it's a smart system. So once you're able to achieve coherence, it monitors your breathing pattern to make sure you stay in that specific pattern. Because some people just need to breathe more rapidly. Some people need to breathe a lot more slower. Or some people's hearts might need to speed up, and that means they're coherent. Other people, it doesn't work. It's not a one-size-fits-all. So this will actually find what makes you coherent, and then it'll make sure that you stay there by monitoring your breathing, monitoring your heart rate, so you can stay in coherence, which is also kind of cool. So to demonstrate this, can I have a volunteer from the audience? Can I pick on anybody? If not, I'll show you mine, and it's going to be a hot mess, but that's okay. Come on up. Thank you very, very much. Let me hold up. I'll have you sit in that chair for me. Oh, come back. There you go. So when you pull up the system, you'll get a screen that looks like this, and it's really confusing to read. I tell people people, the biggest things that you need to know is whether you're red. This system shows you blue rather than yellow, so red, blue, or green. That way to monitor it. So we start by getting just a baseline for people and not even explaining this technology. So I'm going to have you, I'll clean this, don't worry. Attach it to your earlobe and make sure it's pretty firm on your ear. It's not showing on my screen, so I have to. There's my mouse. All right, so you got it on there? Let me know. And it'll take a few minutes just to calibrate. So for people in the front, you can see that I'm kind of reading him. You can do it on your finger, or you can do it on your ear, or if you don't even like the clip, there's a finger sensor too for people that like to hold it. So obviously, since I'm picking on him, he's not coherent. Oh, but laughing? No. So that's good. We'll just pick on you for a couple minutes and just show a baseline. But usually, like I said, I'll just hook people up just to get that baseline. Because I don't want to explain what it's reading. I don't want to explain what it's doing because that's probably going to affect the data a little bit. So, and we do about usually about a 2-minute baseline, so not very long, but enough to get kind of a good reading. I like to ask people kind of their subjective ratings of their depression and anxiety or stress level beforehand, just to see where they're at a baseline as well. Look at him go. We're talking about you and you're already pretty coherent. So you can see it's measuring both the heart rate, and it's kind of a tiny little number, so I can't see what even the top number is. It looks like 90. So he's going up and down between probably about 65 to 90 beats per minute. And you can see kind of both how jagged it is, and then also, it varies between those up and down with the amount of space. So that's what it's measuring. Okay, so we'll stop for a second. Okay. So he actually did pretty good, so you're making me look bad. That's fine. I'll forgive you. And we see this all over the place. Typically with our consumers that are coming in a mental health crisis, their coherence is probably a little bit lower. But it'll kind of show their accumulated score on the bottom. It'll show just their overall kind of heart rhythm pattern on that graph. And then at the bottom, you'll be able to see the coherence. And that's really, for my staff that are running this, I'm telling them that's probably the most important part. You don't really need to explain anything else. So this program, HeartMap, has a whole bunch of different games that people can play. People love computer games, so it actually has multiple games that you can play with consumers to try and teach some of this. So let's see. So there's, depending on people's preference, different things, and the idea is to be coherent. When they're first starting out and learning this program, we like to do the coherence coach. And you kind of just have them look at this ball, and as it's rising, they breathe in, and as it's falling, they breathe out. And again, like I said, this is a smart system, so the speed of the ball will start matching his pace when he's coherent. So you might see it go up and down, depending. People are like, oh no, it's going to work. I will ask you whatever memory that you thought of earlier, try and think of that as you're kind of watching. So get back kind of in that headspace. They're not staring at you, I promise. Try and remember that memory and have that positive feeling kind of in the back of your head. And let me know when you feel like you're there. Good? Okay. So then I'm going to have you just kind of watch the ball and breathe with it for a few minutes. And have that feeling kind of in the back. Remember that memory as you breathe if you want, if that kind of helps maintain that for you. And just as the ball goes up, breathe in, and as the ball comes down, breathe out. We'll just do it for a few minutes. So it probably has to kind of calibrate back to them again since I shut it off. There we go.
Now the second step is adding heart-focused breathing. Maintain your heart focus, and while breathing, imagine that your breath is flowing in and out through your heart. Try this for a few breaths to get comfortable with heart-focused breathing. Now set the breathing pacer to a comfortable pace. While maintaining heart focus and heart breathing, follow the ball. Gently breathe in through your heart as it's going up the curve, and breathe out as it's going down. Use the slider to set the speed of the ball so that you are breathing deeply but easily. Once you've set the pacer to a comfortable level, just keep following the ball, inhaling as it rises and exhaling as it falls.
So they have a chance to
Now let's
adjust
get
it
to the
initially
third
as
and
well.
most important step, the emotional shift. In order to enter a high state of coherence and comfortably sustain coherence, you need to feel a positive emotion. While maintaining heart focus and heart breathing, using the breathing pacer to guide you, try to feel a positive feeling. This could be a feeling of care you have for someone or something, a feeling of appreciation for the good things in your life, or an uplifting feeling you have.
I'm going to go ahead and stop it. Let's make sure that we can stay in time.
Without trying too hard.
Well, thank you. Let's give them a round of applause. Put them on the spot. So on the bottom, it kind of tracks the time. It does the average heart rate. And then once you end it, it'll kind of map his coherence. But you can actually see that even though his coherence was slightly less overall, we did it in a lot less time. Just look at the pattern. Look at how less jagged it is. Look how more even it is. Just in those, I think we did it maybe a minute and a half. Let me go back. So you can see kind of on the left what incoherence might look like. The rate is kind of uneven. The time in between the beats are uneven, but a more coherent rate, kind of more even level. So we've used this at Robert Brown in multiple different ways. We've used it individually with clients on a one-to-one basis. We've actually used it in group too, and allow people to kind of see themselves when we switch off, or if people don't want to use the monitor, that's fine. Because all the monitor does is just show them where they're at. They can follow along with the ball or just do simple breathing and eliciting the positive emotions without being able to see what's in their body. And we've used it both traditionally as HeartMath intended, and we've kind of cheated a little bit and used it to kind of monitor and track coherence using different breathing techniques, different coping skills, even different music. For example, we had a consumer who said, his really calming and soothing music was death metal. So we modulated. I said, fine, let's put that to the test, and it definitely did not turn out that way. And he was shocked by that. I wasn't quite shocked by that, but he was shocked by it because he thought that, he felt relaxed, but in his body he wasn't relaxed. So we did kind of other soothing music, and his coherence shot out to 95% within I think 30 seconds. So it was kind of amazing for him to see. So quickly, I'll kind of go over the stats with you a little bit, and I know this is hard to see for the people in the back. So these are individual levels. So this person's coherence at the start was 16% after two minutes. And then after 2 minutes of practicing just that ball up and down, it looks like it shot to 80%. So that's a huge change. Same thing with this person on the right. Their coherence level was only 5%, but after 2 minutes, shot up to over 80%. So that's pretty amazing. These little lines right here, they must have probably shifted in their seat, and that's just when the monitor kind of lost their rate, which it tends to do. So you can see this person never even got into coherence, but after 2 minutes, shot right out. And these ones are specifically from group. I think a lot of people are a little bit like, I don't know how this works in group. People are staring at me. I'm never going to be able to get it. But we've seen most of the time it does work. Their coherence, about 28%, shot up to 56% being a room full of people, kind of all practicing the same thing. Same here, 37%, and then hit 62% within 2 minutes. So, you know, we've really seen a lot of changes. I think the biggest thing for people that, you know, really is meaningful for me is that consumers have told us afterward that even if they don't feel the effects of it right away, they're surprised that they can take control of something that they had no idea that they could control. And that's amazing, because a lot of times this is all about empowerment, right? So, and that's why we're here. So, thank you. Here's resources. But we wanted to open up to questions about any of the presentations, or just comments, or ways that you guys have brought these into your crisis residential.
We've been doing some work with neurofeedback with some, and having some really nice results. It's probably similar, right? So to
It is.
sustain those results over time. Yeah.
Yeah, I mean, you can track it in different ways. You can kind of log people. We don't usually log them because, like Mallory, typically our length of stay is 5 days.
Right.
But for longer programs, you can actually put people's initials in there, and they can see over, you know, however long that they're with you, improvement in their coherence and what's helped and what.
So these are some folks in the state hospital, and so depending on what they're coming in with, they could go for 30 sessions or 300. It's very expensive. It's not covered by insurance, but it would be if you were in a state hospital. But it's interesting, even my boss, who's the medical director for Connecticut, for mental health, him and I went and met with a guy, and he really believes in it, and he believes that it works, which is great to have his buy-in as a physician. Yes, that's great. And so I just wanted to keep going on to the sensory room. We did a lot of work with occupational therapists with our son, and we're talking about him right now. But as a young kid, ground sensory and integration disorder, and it does work, and it's great. And yeah, and the mindfulness, I was thinking when I go spinning, you know, you used to have to have your head look really clear, and but instead I just start racing, and I just think that more like the future and the past, and I'm not. It's hard to get back in the moment. But thank you. These are great interventions.
Thank you. Any other questions or comments?
How much does the unit cost for the heart map?
It depends on the program that you buy. So the unit comes with different types of programs, which has different things that you can do with it. This one, I believe, was about, I think it was about $250 or $300. And then you can download the program right off online, and it comes with just multiple resources as well. You can get the M-Wave Pro Plus is their kind of premier one, and that's $500. And that way you can log multiple users over time. So if you have a bigger facility and they tend to be there, I mean, you need to kind of watch HIPAA. You know, we've used initials, you know, and the date, even just the first initial and the date to make sure that there's no, we're HIPAA compliant. But you can do it that way, and it's nice for people that are there for a longer time and have multiple, you know, 20 or so sessions in there that they want to be able to see. Any other questions or comments? Okay, well, thank you guys very much.
We have about a 15-minute break, and we will be back at 2:30. There's another breakout session, so there is a session in this room, and then there will be another session next door. So make sure to check out your schedule and figure out which one you want to go. Good job.